I'm David Barnes. I'm an internal medicine physician. We were out on a sightseeing flight east of here, just to the west of Eureka. We don't actually know the circumstances of the accident. The engine appears to have quit. It seems that I was making an emergency landing on the road out by Eureka, and we hit a power line while trying to land. A state trooper came on the accident right after we crashed. He was coming around the corner just as it occurred, and he said that it appeared we were trying to land on the road. The plane was totaled, and we were critically injured, the majority of us. There were 4 people on board, myself, my dad, my mom, and then at the time our second oldest son, Luke, who was 2. The adults were the worst injured. Right after the accident, in the emergency room, when my wife was briefed by the emergency room physicians and the orthopedic surgeon, she was told that there was a 95% chance that my left leg would be amputated and a high chance that I would never walk again. And I am doing what I'm doing, I think, because of prayer, because of physical therapy and surgical skills. I had mainly orthopedic injuries with head injuries. I was hospitalized at Providence for 3 weeks. I had 15 separate orthopedic procedures and a number of blood transfusions. I had 15 separate surgical procedures in a number of different operations, and basically they put things back together, what's called open reduction internal fixations, where they used screws and nails and plates to put things back together and stabilize the joints. And I then had recuperation time where I was non-weight bearing in a wheelchair for 90 days. This x-ray that we put up was the left knee, and the knee was just one of the joints that were injured, and the patella was completely disrupted, exploded, comminuted. The lateral collateral ligament was torn off, the posterior collateral ligament was also torn off, and then the knee was traumatically dislocated on top of that. The diagnosis at the time was multiple fractures. I had fractures of the distal tibia and fibula where they were compressed and pushed upward. Essentially, I was a number of inches shorter. As I said, the knee was traumatically dislocated with a number of avulsions. The left hip was fractured. It was driven through the pelvis, and the pelvis was also fractured. The left wrist was traumatically dislocated. The radius and ulna were fractured. And I had a number of facial fractures and lacerations in addition to head injuries. The orthopede initially was unaware that that was available, but when he heard it was, he was quite excited about it. And yes, then he prescribed that I use the HydroTrack. I went to Wasilla Physical Therapy. It started out with the HydroTrack, which was outstanding both mentally and physically. The HydroTrack allowed me to get up and start walking at an offloaded weight. The HydroTrack immersed me in water, so using buoyancy, I was able to walk without putting any weight on my joints. It was really big, I thought, for helping pain. Getting out and actually moving helped my pain a lot, but it allowed me to strengthen was the big thing. I hadn't walked or had any weight bearing on my legs for a full 90 days, and so I was quite weak at that point. They had me doing non-weight bearing exercises with the joints, but that didn't do anything for strength. One of the biggest benefits was that my pain went down in addition to the strength increasing, and it helped my mental attitude significantly. To be vertical and actually walking, even though it was in water in the HydroTrack, was really helpful. Teresa, my physical therapist, was very helpful. She motivated me. She knew all current things to do. She was great on giving me home exercises, keeping me going during the actual physical therapy when it hurt, and my overall care at Wasilla Physical Therapy was excellent. I would say for anybody who's considering the HydroTrack, definitely use it. I actually send patients of my own that are applicable for it to use the HydroTrack. It's definitely a very good tool that I think will help people recover quicker and feel better faster. I think I've definitely gone beyond where I was supposed to. My lifestyle now is not 100%, but it has gotten me back amazingly. I credit a number of things. I credit God, I credit the surgeons, I credit the physical therapists that have gotten me back where I am today, and I definitely couldn't have done it without all those people helping.
I understand you have 5 boys?
Yes.
Very active?
Yes, 5 active boys. We're able to hike, we fish, we camp. I'm doing phenomenally well. I know a lot of people my age who are not able, that are normal, who are not able to do what I do, so I don't let this limit me. It hurts, but you just get on with life and do what you need to do. I would recommend Wasilla Physical Therapy just because of the way I was treated there. I got outstanding care. The outcome of my care was great. They're good people, they're knowledgeable, they're current, they have good equipment, and I felt comfortable there.